Today we discuss one of the most common important viral disease is the lumpy skin disease. Simply it is known as the LSD. Lumpy skin disease, it is a systemic disease mainly in cattle caused by Capri virus and it having close antigenic relationship with goat and sheeppox virus. Transmission of lumpy skin disease, there are different mode of transmission of lumpy skin disease. Out of that, secretion of infected animal, like all secretion like semen, milk, nasal secretion, lacrimal secretion, etc. And next mode of transmission is there are different type of tick are also responsible for transmission of this lumpy skin disease. Mainly Rhipicephalus and Amblyomma species are mainly responsible, and different species of fly and mosquito are also responsible for transmission of disease. Next mode of transmission with the contaminated syringe and the needle also can transmit the lumpy skin disease. Animal risk factor. All age group of animal are susceptible, but in case of cow and lactating animal, show the severe clinical symptom. In some skin disease also reported in the buffalo. Economic loss. Economic loss due to high mortality and morbidity rate and decrease the milk production, height damage, abortion in pregnant cow and mastitis due to teeth lesion. In some country it is also used as a bioterrorism. Clinical finding or clinical symptom in lumpy skin disease. In field condition, the incubation period of the virus is the 7 to 14 days. After that, we will get the high rise of temperature, nasal discharge, salivation and lameness. And most common important clinical finding we will get the multiple intradermal nodule appear suddenly about 1 week. Nodule having 1 to 4 cm in diameter. In most of the cases, the nodule disappear rapidly, but in some time it may be moist, necrotic and then slough. In pregnant animal, we have found the abortion, and the total course of the disease is the 4 to 10 weeks. Diagnosis of lumpy skin disease with the help of clinical symptom. In field condition, with the help of clinical symptom, we can easily diagnose the lumpy skin disease. Next is the laboratory method. The most common serological test used for diagnosis is the virus neutralization test and agar-gel immunodiffusion test. And next method is the molecular technique with the help of PCR. Next mode of diagnosis with the help of histopathology. In histopathology of skin, we will get the intracellular eosinophilic inclusion body in lesion. Treatment of lumpy skin disease. All of you know that in viral disease there is no specific treatment. That's why we have to treat the animal symptomatically. And first, we have to use one broad spectrum antibiotic, minimum duration 3 days, to prevent the secondary bacterial infection. Next, we will get the fever. That's why we have to use one anti-inflammatory and antipyretic drug. There are different products is available in market. Out of that, we generally use meloxicam, flunexin, megludine, tolfenamic acid. We can use. Next, we have to improve the immunity of the animal. That's why we can use vitamin C and levomethal. We can generally use to increase the immunity of the animal. To prevent the release of histamine, generally one course of antihistaminic we generally use. In affected animal, we have found there is nodule formation and sometimes maybe ulcer. In that cases, first we have to clean the nodule or ulcer part with the help of antiseptic solution. After that, we use one fly repellent or wound healing, any type of spray like DMX spray or any other spray. We can prevention and control of lumpy skin disease. All of you know that it is a viral disease. There is no specific treatment. That's why we have to prevent the lumpy skin disease with the help of different method. First method is the movement of animal should be banned. Next method, seek biosecurity measure. And next method we commonly use, animals should be treated with acaricidal drug to remove the tick and lice from animal body. so that the transmission of disease should be less. And next method is the vaccination. It is the most commonly used to prevent this lumpy skin disease. In market, newly one vaccine has come. This is name is the Lumpy Vax, and which should be administered greater than 4 months of age animal, and it should be administered subcutaneously. And you should remember, it should not be used less than 4 months of age animal.